The Next Step Clinic is a comprehensive and holistic overview on how to live well after a breast cancer diagnosis. It covers all the key themes that women need for survivorship that we found over the years come up again and again.
I was watching TV with my family one day and I felt this weird pain in my right breast, and when I felt it, then I felt a lump, and I happened to have my annual doctor appointment in the following week, so I was like, I'll just wait, see what she says. And she said, knowing your family history, that she would send me for a mammo and ultrasound. After my mammo and ultrasound, then they sent me for a biopsy of my lump and also my lymph nodes. And then right away it kind of was a whirlwind of, you have to get an MRI, a PET scan, all of this, and then, okay, you're starting chemo on Monday, and Friday you're getting your port surgery.
After a breast cancer diagnosis, what I find with the women that I see in my practice is that there's a tremendous sense of uncertainty and vulnerability. Those are really the two themes that stand out.
I did chemo for 18 weeks, and then after that I had a double mastectomy, and then after that I had radiation, and then that finished, and I'm still currently in the reconstruction process, which is a process.
What the Next Step Clinic tries to highlight is the different areas of vulnerability and different questions that women have after going through breast cancer in terms of their sexuality, their finances, their spirituality, their diet, their lifestyle in general. And we really try to present a holistic, comprehensive, and healthy way to point the way forward after breast cancer treatment. And it's really rebuilding that trust in their own body and rebuilding that trust in themselves that they are safe and they are going to be taken care of still no matter what happens.
As a cancer survivor, and especially breast cancer, and especially the fact that it was in my lymph nodes, you kind of always have the worry of if it comes back. And if it comes back for me, it'll be either in my bones or an organ. So sometimes that's scary. But so that's why I think even though you're done, you're kind of never done with this. So it's nice that the hospital has this program, because you want to get in the best shape, eating healthy, doing everything that you possibly can to try to avoid that from happening again.
When I'm talking to survivors in the Next Step Clinic, one of the big issues that comes up always I think for everybody is how to manage stress in a healthy way. And so I cover things related to, say, mindfulness meditation, and also some of the research, some of the great research about how exercise is so important, not just in managing mood, but we're finding maybe it has a role to play in limiting recurrence of disease. Also healthy ways to go to sleep without sleeping pills. Those are the kinds of things that I can cover, and pretty much everybody has questions about. And other piece is the anxiety. Between the actual diagnosis itself, the changes in their families, their relationships, and some of the medications even can trigger very potent anxiety episodes.
There's so many ups and downs, and it's like a roller coaster of emotions, anger, sadness, happiness, you're done, you made it. With my mom, my kids, my husband, and, learning how to communicate my feelings again, and not just keeping it all inside for the fears or, anxieties.
Our support services can really help the patient, not just from the medical standpoint, but help the entire patient and the family as they're going through in our cancer center.
Hi, nice to meet you. My name's Elizabeth.
Whether it's talking to their employer about their upcoming treatments, or if you have a first date, and how do you tell that person on the first date about your newly diagnosis? Sexuality is sometimes a very hard subject to bring up with patients, and it's really how do you discuss it with your partner?
And it's really important also to instill a sense of hope that things do get better. Time does heal many of these issues, and there's also other things that women can do, and those are the kinds of things that we cover in the Next Step Clinic.
I was sick in bed a lot of the time from chemo, and so that my husband and my mom and my kids and the emotions that their life gets to go on, but yours is put on pause. So that is a big part of needing somebody to say it's okay and it's not your fault, and that other people feel the same way,
There is a right time to treat breast cancer, but there's always time to live well. And the Next Step Clinic offers us guidance, and it offers us support in how to live better after breast cancer treatment and diagnosis. One question I ask a lot of my patients is, what is the life you fought for? And the Next Step Clinic offers them steps towards living that life that they fought for.
After my surgery, they saw that all my cancer was dead, and so they classified me as no evidence of disease. All the staff at the breast center were just so warm and caring, and I really felt that they cared about me as a person and my survival, and that they were like cheerleaders to me. It's just very unique and very special what they create there.